Okay, yeah, there's not much to speak about here. So let's say, so this one's the oral treatment. So what do you think about treatment options of drugs that are targeting systemic versus ones that are targeting only the CNS? Do you think you'll see a difference between these two sort of mechanisms of action, and how will they reflect on sort of patient outcomes?
Yeah, I mean, you'd worry about two things, right? You'd worry about enough CNS penetration, so that's the first factor. So you'd hope that it would penetrate the CNS as well as other drug delivery systems. But then secondly would be a safety issue, right? So, are these drugs, or, the systemically delivered drugs, are they having side effects in other organs because of the delivery? So I don't know the answers to those, but I would hope that, ideally it would be, yes, bioavailable, it would penetrate the CNS, and two, it would not have, side effects in other organs because it is systemically delivered.
Mm-hmm. And would you consider the orals to have any positive effects, considering there's some talk about SMA being, a disease of peripheral organs as well? There's conversation about that.
Right. Yeah, no, that I don't think has been proven yet. But I mean, if it were to be, if we were able to see that there were other organ involvement, then I think there would be a benefit of a systemically delivered drug to then, potentially, help those other organs or treat the dysfunction in those other organs.
Mm-hmm. Okay, so actually to sum up now, just kind of going to try to get your overall view. As you think back to these three products, how would you compare the mechanisms of these three products, and which of these mechanisms do you think will or will not complement each other?
I mean, I think let me just go back to that. There it is right there. I mean, I think all three of these mechanisms really do target the underlying problem in SMA. I think, in terms of complementary, in other words, using more than one, I think that, I've said this all along. I mean, if we can just restore the problem or fix the problem with a drug like Avexis, I don't know that the other two, at least Spinraza now, when I'm looking at the Roche drug, I don't know that those would be necessary unless, let's say, Avexis rather lost its efficacy or lost its durability. So I suppose in a situation where, let's say, Avexis works, but it didn't, have a durable effect, as we talked about a few minutes ago, then I think either one of these other agents could be used, as a kind of complement or as kind of an add-on therapy. But I don't know about using, from the get-go, at least more than one.
Mm-hmm. And then just to summarize the relative impact on efficacy, your perception of it of these three products. If do you believe that will you make a treatment decision? If you want to make a treatment decision based on the fact that you want to get the maximum efficacy and at the fastest time possible, which of these three products would you sort of pick?
Yeah, I mean, I think, it's the same as kind of what I said before. I mean, I think I would pick the Avexis product.
Okay, and do you think the orals will, have a place in that decision, or do you think they would be fast-acting enough, or would they achieve maximum efficacy?
Well, I think I guess the analogy I'm using is, other situations clinically where we have IV versus oral formulations, and, the impression I have and, the pharmacodynamics of it is typically that IV works faster. So, I mean, I think there is a place for oral medication, but if you're talking about time to action, I mean, I would suspect that IV is going to work faster than oral.
Okay, great. And finally, just to sum up, thinking about, in a few years when all these treatments will be available, if you were to make a recommendation to a colleague about the options available for SMA, how would you sort of summarize these three products, and how would you sort of describe their appropriateness in the different patient segments that we talked about?
Yeah, I mean, I would say that, again, assuming they're all efficacious and safe, I mean, I would say that the earlier you can treat patients, after the time of diagnosis, the better.